One of the most misunderstood chronic health conditions is mental illness. Most people living with mental illness manage very well and enjoy abundant lives. But there are times when a person's mental illness may intensify and affect the way they act toward themselves and others. My name is Renee, and I'm your host for the second of 3 episodes on older adult mental health. One of the most common situations you'll face is caring for a person in a mental health crisis. The crisis may involve physical aggression, verbal insults, self-harm, or a break from reality where a person may hear voices or see images that are not real. Persons in a mental health crisis need your full respect and professional care. So let's talk about some tools and approaches to help prevent mental health crises from happening in the first place. We'll also show how to de-escalate crises once they start. This session comes with checklists and other resources you can print out and use in your daily work. In this session, we'll discuss how your response determines the outcome of a crisis, prevention tips to reduce the chance of a crisis, early warning signs and techniques to de-escalate a crisis, and how to apply what you learn in your daily work. Mental health crises happen often, so what do we, with little or no training, usually do? Well, our instincts take over and we either yell back at a person who might be screaming, or we might grab the person's hand, arm, or leg to stop a physical attack. These instincts rarely work and usually just make matters worse. Your response determines the outcome in every mental health crisis. Even though you're not the cause, the way you respond as a caregiver will determine the course of the incident. Will your actions make matters worse, or will you be able to de-escalate or calm the situation?
A lot of the work that we do is to encourage people to do things that they're disinclined to do. Maybe it's to take care of their apartment. Maybe it's to make an appointment that they need to make. We're encouraging them to do something that they otherwise would be disinclined to do. Maybe it's to change clothes or take a bath. And to the extent that we do that in a way that we're seen as an ally and not an adversary, we're going to be more effective.
So what are some examples of mental health crises? Verbal threats to harm self or another person, destructive behavior, hitting, spitting, kicking, throwing, or breaking items, unable to control impulses such as inappropriate sexual behavior. Did you notice I didn't list defiant behavior? Refusing to follow directions or take medications may seem like a big problem to you, but it's not a crisis. Defiant behavior is usually about communicating a message. When this occurs, try to find out what the person is trying to communicate. You're likely to reduce defiant behavior if you can identify the underlying need. While defiant behavior is not a crisis in and of itself, it can be one of the early warning signs that a crisis is about to erupt. That's why it's important to understand the life cycle of a mental health crisis.
There's a life cycle to a crisis. It's got a beginning, it's got a middle, and it has an end. And as caregivers, you have a responsibility to know how to adjust your approach depending on where you're at in that life cycle of a crisis.
The National Crisis Intervention Team Program explains there are 4 stages in a mental health crisis. Understanding this life cycle will help you respond more quickly and confidently to people experiencing a crisis. Stage 1 is the early warning period, where someone seems overly anxious or irritable.
You may have an increase in activity. Maybe the person is wringing their hands. Maybe they're rocking in their chair. Maybe they're staring. There's an increase in activity, there's an increase in the intensity. And at that point, as caregivers, we're simply reaching out to them and saying, "Are you okay?"
What should you do at this stage? Offer support and use active listening.
You're responding to them and giving them options, and you're stating positive choices first.
Ask the person if changing locations or finding another activity might help them feel less agitated. Stage 2 is the point where the person's behavior begins to disrupt others around them.
The next stage in that de-escalation of a crisis is the beginning of the loss of rationality, where we're asking if the person's okay, and they're responding to us, "Yeah, I'm okay. Are you okay?" And they're beginning to challenge us. And in particular for new caregivers, this can be difficult because there's a challenge to your authority. And the temptation is to say, "Don't talk like that to me." But really, what you need to be doing is saying, "I'm uncomfortable with where this discussion's going. And I may need to have you take a step back." Or I'm not comfortable where this is going, and I may need to take a step back and disengage from the conversation.
Stage 3. The person's actions have reached a point where they are now a threat to themselves or others. Your focus at this stage is safety. The safety of others as well as your own safety. Hostility at this stage is serious and the risk for injury is high. This is the time to get help from others. Call your colleagues for help. If you're a family caregiver, seek immediate assistance from other family members or nearby neighbors who can help.
When the person is in the full-blown crisis, we're not putting our hands on someone. And we're going to let someone do property damage before we're restraining someone. When you're trying to restrain someone, people get hurt. It's not a good idea. And I'll live with a broken lamp. That's far better than someone having a broken finger or a broken arm.
Stage 4 is when you sense things are beginning to calm down.
After the lamp is knocked over, or after the person's had a verbal outburst, then we're re-engaging them and trying to figure out what was the antecedent to this, what preceded this, what was the behavior about, and what's the consequence.
During this stage, focus on restoring communication between you and the person. This is the best time to talk calmly with the person to find out what caused them to act out. This is also the point to discuss any consequences for the person. Finally, after you've had time to talk and deal with the immediate aftermath, step away for a while to clear your mind and debrief. It's critical to recenter yourself so you can return to your responsibilities as a caregiver. A lot of caregivers say, "Wait a minute, this life cycle stuff never happens with me. I care for people who go from peaceful to violent or 0 to 100 in a blink of an eye." Rarely do these quick triggers happen. What's really happened is the caregiver failed to pick up on important cues in the earlier life cycle stages, and they missed opportunities to intervene sooner and prevent a full-fledged crisis. When someone is under stress, real or imagined, or their cognitive abilities are compromised from mental illness or brain injury, their fight or flight reactions can be triggered much more quickly than yours. Your relationship with the person you're caring for is the key to understanding their behaviors. If you know the person well enough, you should get pretty good at detecting even subtle cues that something might be wrong.
When you're thinking about a crisis developing, there's a few things that you can do. One is you want to build rapport, and 2, you want to remain calm. And remaining calm is perhaps the harder part of it. And I'm going to argue that developing rapport part is the part that you've developed before the crisis develops.
Here's a few prevention tips to remember. Prevention tip number 1. Determine the level of stimulation and uncertainty a person can handle. If they seem irritated by noise or large groups, then it would be wise to find small, quiet spaces and avoid large gatherings like mealtime or large group activities.
So I try to find a quiet space to talk to the person. I try to be at the same level that they are physically. I try to talk softly, and I try to spend a lot of time listening. I always say that we have 2 ears, 1 mouth, and if we used it in that proportion, we probably wouldn't go wrong.
Prevention tip number 2. Understand early warning signs. Early warning signs to watch for include verbal and physical aggression, such as swearing, hitting, or yelling, pacing, rocking, or staring. Invasion of personal space, when someone literally gets in your face or it's so close that it makes you uncomfortable. Perceived feelings of being disrespected by others or having their stuff messed with.
If someone's making threats of aggression, that's a predictor. And if they're making specific threats, that's even a greater predictor. So if someone says, I could kill someone, that's not so much a specific threat. But if someone says, I'm going to my apartment, I'm getting some golf clubs, and John, I'm coming to take you out, that's a really specific threat. And I don't care if it comes from the guy that doesn't have golf clubs, I still want to make a big deal about it.
Prevention tip number 3, avoid power struggles. Many mental health crises arise from power struggles that spiral out of control. Be conscious of the way you explain and enforce rules or directions. For example, if someone becomes more and more agitated or resistant when you urge them to take their medications, try to find out why. Instead of dwelling on the conflicting behavior, view it as an opportunity to help a person do a better job of expressing their wants and needs. You can prevent many crises yourself by temporarily backing off and backing away from power struggles. Instead, ask others for help in finding alternatives that promote cooperation instead of conflict.
We're encouraging people to do things that they might not want to do. And I think that it's important that we give people some choice. So for example, you're asking John gets up and most mornings John puts on his compression socks. And you're trying to, it's your job to get the compression socks on John. And John says, today I don't want to do it. And you say, I know, that's frustrating, John. It's no fun to do that. But what time would be a good time to do it? I understand you don't want to do it right now. How about if you come back? You want to come back in 5 minutes? Giving a person choices and making them feel like they've got some influence and power and control over their own life is important. And that it's not based on your schedule, that you have some sensitivity to their schedule.
Prevention tip number 4, develop a personal prevention plan. A personal prevention plan is another tool to help prevent crises. It's as easy as talking with a person to help them identify triggers that make them nervous or angry. You then help them choose calming strategies when they're having a hard time. If loud noises trigger their anger, then one calming strategy might be to listen to some soft music.
Not in the crisis so much. You can ask them then too, what will help you? What have you called upon in the past that makes you feel better? And if it's someone who's managed an illness since they've been a young person, which these are young person's onsets, they typically can tell you what's worked for them.
This personal prevention plan should include a review of any past crises to help the person realize the extent their actions have on themselves and others.
Part of prevention is in working with people and being able to engage people when they're struggling is the degree to which you've got to know them. Do you know their name? Do you greet them by name? Do you know if they've got kids? Do you know if they have a mother? Do you know where they grew up? What do you know about them that gives you a rapport with them to be able to talk to them? To the extent that you have that rapport, you're going to be more effective.
Prevention tip number 5, develop communication awareness. This involves understanding of body language and nonverbal communication. It also includes the volume and tone of verbal communication.
It's important when you're working with someone who's trying to push your buttons or seeing if they can engage you in conflict to really regroup and to think about what your response is, what your body language is, what your facial expression is, and what your tone of voice is. And tone, volume, and cadence is really important, that you're not reacting in a way that increases the tension in the relationship, that you're giving a really rational response to what may be kind of a line of attack.
So make a conscious effort to observe verbal and nonverbal expressions with the folks you're caring for. They may signal you to step in or back away sooner to reduce the chance of a crisis. De-escalating mental health crises. So you've tried prevention and run through all the checklists, but nothing seems to work. When a crisis does happen, use listen, understand, act to help de-escalate serious physical and verbal situations.
So the steps that we've defined here, listen, understand, and act, can be used in ways like this. In the beginning of a situation, you want to be very aware of what a person is saying, both verbally and non-verbally. Pay attention to the situation, listen to what someone is saying, and validate back to them that you have heard it and are working to understand it. Ask them what would help them. They might be able to give you an action that you could then take, which would help alleviate the situation.
Listen. Approach the person from the front so they can see you. Never come up from behind. You could startle the person and cause them to lash out. Appear calm and relaxed. Let the person know you are actively listening without judgment. Use occasional listening sounds and a head nod or two. Repeat back what the person has said to let them know you have their full attention and respect.
Active listening is really important, and the active listening is really the idea that while you're listening to the person, you're having responses that suggest that you're hearing what they have to say.
You can certainly tell somebody you're listening by nodding, by maybe repeating occasionally back what they said to make sure you understood correctly, but let them do most of the talking, and that has great value for that person.
Show you understand. Don't argue or become defensive. View the problem from the person's point of view. You might say, "I'm sorry you're feeling that way." Let the person vent. Don't take their insults or foul language personally. Avoid becoming emotional yourself, because that might cause you to overreact. It's up to you to keep the conversation neutral. Act. The crisis is unlikely to subside unless you take steps to act. So do what you can to calm the person and solve the problem. This might involve moving a person to a safer place, moving others away from the person, closing the door in the room where the person is in, asking others for help when you're unable to solve the problem quickly.
Conflict happens in large measure when there's an audience. Boxing matches don't happen without an audience. When there's a fight, a lot of the fight is fueled by the audience, and power struggles are no different. So when you have an audience and you express something to someone, you want to do so in a way that eliminates the audience.
Safety is the key in these situations. Always leave yourself an out. Don't get cornered in a room where it could be hard to leave if the person begins hitting or kicking. Once the person has calmed down, you can talk about what happened and what you and a person might do the next time. Ask the person to repeat back what they've agreed with you to do the next time they feel agitated. The actions for next time must be something that you can and are willing to do. If you don't respond as agreed, you'll violate any trust or respect you've created. As hard as we try, sometimes our words can just make matters worse. When you're in the middle of helping a person in a mental health crisis, never say, "Calm down. What's your problem?" Because those are the rules. It's none of your business. "I'm not going to tell you again." "Why can't you be reasonable?" Or, "I'm doing this for your own good." What would you do? Let's watch a few clips of how a caregiver responds to a few common crisis situations. How would you respond? Can you spot the listen, understand, and act steps? Our first example is the power struggle. In this clip, the caregiver needs John to put on his compression socks so he can go down for breakfast. Pay attention to how things quickly escalate into a shouting match.
Hi, John. I want you to put on your socks so that I can take you to breakfast.
I'm not putting no damn socks on.
Put your socks on now.
No.
If you don't put your socks on, you're not gonna go for breakfast.
Your breakfast stink around here.
Put your socks on. I'm not gonna tell you again.
Don't touch me.
You hit me? I'm gonna make sure you are kicked out of this room.
What steps could the assistant have taken to reduce the tension? What actions did the caregiver do that you should never do? Let's take another look at the same situation again.
Hello, John. I want you to put your socks on so that I can take you to breakfast.
I'm not putting no damn socks on.
You seem really upset. Is there anything I can do to help you?
Nobody cares around about me. Just go away.
Oh, John. Did your daughter come yesterday to take you to lunch?
No, she canceled out like she usually does.
Oh, I can certainly understand. Yesterday, it snowed 12 inches of snow. Maybe that's why she didn't make it.
Well, I didn't know that. I was watching football all day. You know, we have a really good quarterback.
Oh, maybe that is why. Since you understand, could you please put your socks on because they are serving your favorite breakfast, French toast. Now can you put your socks on, then I can take you?
I don't want to miss that.
Good.
I'll put my socks on and come right down.
Go ahead.
What was different? Did you hear a pleasant tone of voice? Did you notice the assistant sat down by John? Did you realize how little time was spent on getting John to put on his socks?
If I'm working with someone who's really angry and frustrated, and say they come charging up to me and they say, I need to talk to you, I would rather walk with that person side by side than sit and look and stare at them face to face. I'd say, let's walk and talk. And I'd rather go to an area where there's going to be a lower arousal level. If I can go to a private space, that's ideal. If I can leave the door open so that perhaps somebody else is aware that I'm in there with someone who's really angry. And I'm going to sit in a way that I can get out of the room without having to go through the client, and vice versa, that the client can get up and leave the room without having to go through me. That's going to feel safer.
Here's another common situation. You come upon a person who is physically agitated and verbally abusive. You need to de-escalate behavior that might lead a person to hurting himself or others. In this clip, the caregiver sees John physically agitated. He's pushing his food away and yelling at everyone to leave him alone. The caregiver is worried John might hurt himself or others.
John, stop it right now.
I can't stand this place.
Calm down.
You calm down.
Listen, I'm in charge here, not you.
Get your damn hands off me. You're the meanest person I ever met. I get a headache just looking at you.
You are discovering the person I ever met.
Hit me. Go ahead. Hit me. I dare you.
How did things spiral out of control so fast? What actions did the caregiver do that you should never do?
Someone were to do a clothing grab and grab my shirt, I'm going to do a windmill and spin my arm away and use leverage and momentum to get away from something like that. If someone's going to try to take a swing at me, I'm going to try and block it and use leverage and momentum, and I'm going to go away.
Let's take another look at the same situation again.
Hey, buddy, what's wrong?
Sick and tired of this place. Leave me alone.
It sounds like you would like to be by yourself for a little while.
It's so noisy. I have a headache.
I'm hearing that your head hurts. How long has this been going on?
Since last night. I hate this food, and I hate you too.
I think we should go to see Tommy. You know Tommy. She's our head nurse, the one who helped you when you had pneumonia.
My head really hurts.
That's why we should see Tommy. She might be able to give you some medicine for your pain.
That would be great. I can't concentrate.
I understand. This must be very tough for you right now.
I'm really glad you're here tonight. Thanks for listening.
What was the difference here? What was the cause of the aggressive behavior? Did you notice other steps the caregiver took to de-escalate the situation?
I think whether you speak the same language or not is your presence and building that trusting relationship with the patient makes a big difference.
It's not about you. It's easy to become frustrated in the middle of a crisis. You feel like you're running in slow motion and that the situation will never end. But remind yourself, aggressive actions and verbal insults are caused by an illness and not by a person being intentionally mean. So guard against using derogatory terms whenever you're talking to yourself or others about difficult clients. The words you use to describe others can affect the way we respond to them. Keep your conversation clinical and avoid schoolyard labels like crazy or loony. It's normal to take things personally and feel bad about what is said and done to you, but what is said and done by persons living with a mental illness is not a reflection of you or about you. What is about you is the way you respond when you confront a person in a mental health crisis. Remember, you're the one that determines the outcome. So use the prevention and de-escalation tips we've shared to avoid the trap of letting your emotions and anger make matters worse. Your work can be challenging, so self-care is vital for you and those you care for. Be sure to find time to check in with your colleagues and find ways for self-care.
Or you're a caregiver at home, or you're both. You have to have some outlet, and if you're not sure like what that outlet is or where to start, you can use some of your health insurance time to see a practitioner yourself just to get some coaching.
How to apply what you've learned in your daily work. Your response determines the outcome of a behavioral crisis event. Learn the early warning signs like uncontrolled swearing or confrontations involving the invasion of your personal space. Avoid power struggles. Help develop a personal prevention plan that identifies triggers and calming strategies. Remain calm and ask for help when caring for residents who seem to thrive on conflict or require constant attention for every minor need. Understand the behavioral event life cycle. Use the listen, understand, act to help de-escalate a crisis. Memorize the never say words and then never say them. And role play and review your de-escalation responses with your colleagues or family caregivers. We hope this episode increases your confidence when you care for older adults with mental health crises. Be sure to download the resources and tips sheets we prepared for you. This video is funded by the Stratus Health Building Healthier Communities program.